It's another wonderful day in beautiful sunny Scottsdale. And guess what, Scott? It's getting hot.
Very hot.
It's May 1st. It's hot in the desert. Did anybody ever tell you that?
Yeah. Oh, yeah, I've heard it before. It's a dry heat, though.
He's actually born and raised in Arizona. He knows what I'm talking about.
I do.
But I'm wearing this Hawaiian shirt. Hopefully, it'll help me feel a little cooler later.
Channeling the tropical vibes. I like that.
Yeah, hasn't worked yet.
No.
But I do see, everybody, that he's still drinking Juven.
I just can't get enough. It's so good.
I think he's just trying to cool off. I've seen that thing get refilled 10 times today.
It is fruit punch. I'm channeling my tropical paradise like you are too.
That is true.
Yeah.
It is fruit punch. That's our favorite of all time flavor. There's only 2 flavors, but
this is the one.
This is the one that's doing it for Dr. Ogley.
Yes.
All right. So welcome, everyone. We're going to be talking about one of our favorite procedures today, the modified spiral thigh lift. And, thighs are challenging.
I would agree, yeah. We both do it. We both love it, but it's a tough case.
Yeah, so a lot of plastic surgeons don't offer thigh lift. They don't offer anything really below that gluteal fold, but we do, and we've been offering for over 10 years. Surgery in major weight loss patients and other patients who have just developed cellulite, the thigh lift.
Yes.
Yeah, you're pretty comfortable with it, aren't you?
Yes, I love the thigh lift. It's a really powerful procedure. There's not a lot of other ways to treat some of these things that we're going to talk about that it treats. So it's a great tool for that.
Now, why do we call it, the modified spiral? So there is an older technique. I think it's over 15 years now that's called the spiral thigh lift. And the idea there is to create a spiral around, starting at the buttock, going around the body in the front of the thighs and down into the thighs. And so it looks like a spiral from far away. But the problem with that is that it doesn't give you the right directions of pull.
Yes.
Right? So we modified the vectors. Vectors is the word that plastic surgeons love to use. Instead of just saying the direction that we're going in, right? Which would be easier.
It just sounds fancier, though.
It sounds really fancy, vector.
Yeah.
We're going to use a vector. And so we changed and modified the vector so that we're able to go ahead and get a real solid lift. We are, I think this modified spiral thigh lift is a lifting technique, while the traditional spiral is more of a contouring technique.
Yeah.
That's the way that I think about them.
Yeah, I would agree. Yeah, it's lifting up. It's counteracting gravity, which has pulled things down and created a lot of these problems here.
Yeah, absolutely. So one of the things about thigh lift that's created, a challenge for plastic surgeons is that, these are very sensitive areas that tend to be some of the more contaminated areas in the body. It's definitely not a clean surgery like a breast augmentation is or a facelift. And so there's some concerns with wound healing and infections and open sores. But we figured out a way to really minimize the risk of the operation. We'll talk a little bit about who we think is a good candidate and how we can prepare you to achieve a better outcome. Okay. So most commonly, it's the weight loss patient who needs a good thigh lift. Would you agree with that?
Yeah, it's typically people that have stretched their skin, deflated their skin, and that's going to sag, especially around the buttock, the lower buttock, the inner thighs, and the upper butt as well.
That's an excellent point he just made. And just to clarify, the modified spiral thigh lift is a gluteal thigh lift.
Yes.
It's not a knee lift, everybody.
It does not touch the knees.
Yeah. So that's important because we do get some patients who really want something done with their knees. And for that, there aren't really any good surgeries, which is a bummer. No one's figured out how to put a significant skin resection in the knees and make the scar disappear. But we can definitely hide the scars very, very nicely when we're doing a modified spiral thigh lift.
Yeah, it hides in natural creases that already exist, which is what plastic surgeons are very good at, taking something that already exists and hiding something there.
Now, we have an example here. We have a before and after, and we'll talk a little bit about this case. Do we have any other pictures by any chance? Do we have any from the backside? There you go. Let's talk about the backside, right? And the reason I want to talk about the backside first is because a lot of our patients have already had work in the front. They've had a tummy tuck. And look, tummy tucks are winners. They make women feel so much more confident. And tummy tucks reverses the changes, the negative changes that sometimes are left over from having a pregnancy.
Yeah.
But people forget the backside.
Yeah, it doesn't get as much love. And so that's why people come in already having the tummy tuck without really addressing much of what's going on in the back.
Yeah. Sometimes we do the front and back together, but a lot of our cases have been just focusing on those areas that don't get a lot of attention until you look so good in the front, but you still feel so uncomfortable in that bathing suit. And you want to do something about the irregularities in the gluteal fold like we see in this lady, the cellulite, the deflation, the dimples. There's also some extra fat around the hips, around the top of the underwear that make this patient's buttock look square and somewhat flat. Okay?
Yeah, unbalanced.
Yeah. So let's show a little video. This is a video where I'm doing a modified spiral thigh lift. And this only shows the top part of the operation, but we do something underneath as well. Here's the video. You can see the markings for the skin that's going to be excised to create that good lift. Where you see the positive, that's where we're going to inject a little bit of fat, okay? So what's wonderful about this operation is that we liposuction first so that we can remove the skin, get the good lift, and we don't need a drain. So here, what you guys are seeing is that we've already performed the liposuction, and you see, what do you see? A honeycomb, right?
Honeycombing. Liposuction has been done there very recently.
Yeah, so we pre-treat the area with liposuction. The advantage there is that you don't need to put a drain. And, of course, our patients love that about this procedure.
We love that, too.
Yeah, we love it, too, because we don't have to take care of the drain afterwards. And so we get a really nice amount of skin. I think, the segments of skin that we remove are quite sizable, almost like tummy tuck
Always more than
specimens.
you expect. Even somebody who's thin without a lot of redundant skin, you can still get a really good amount out.
Absolutely. Now, once we remove the skin for a little while before we complete the closure, you'll see next that we're going to put some staples, and we're not going to leave the staples.
No, temporary.
But what we're going to do is we're going to adjust. We're going to adjust the skin. If we need to take a little more skin to get them really nice and tight, we're going to go ahead and do this. So there you see the staples going in. And so this is the last thing before we put in the sutures in there. Okay, so we do a 3-layered closure with some very powerful, strong sutures to really get that good lift. All right, so that's just a video restarting again, but you guys have seen that. A procedure like this probably takes about 4 hours to do from the front and back, and including the inner thighs. Mm-hmm. And some patients have asked me, do you think this is going to come back? And my opinion is that it won't come back because we're removing so much skin. What do you think, Scott?
Yeah, I mean, this doesn't stop aging. This reverses it, and you kind of keep aging. But the significant laxity you see before the surgery, I don't think will return unless there's a significant amount of weight change again or some other confounding factor.
Yeah, no, I think that's a really important point, because that's one of my concerns as a plastic surgeon is we know that patients who get to the stage where they need a buttock thigh lift, a modified spiral thigh lift, well, a lot of things have happened in their life where they've gained weight, they've lost weight, they've gone on crash diets, they've malnutritioned their bodies. If you continue to do that after a spiral thigh lift, I think you're going to get some of that cellulite.
Yeah, certainly.
But if you take good care of yourself, you avoid things that are bad for you, like nicotine, cigarettes, you don't have the yo-yo diets, and you feed your body really well, the collagen will be strong, and you really won't experience much of a relapse. Now, I actually honestly think about this surgery like a facelift. You do a facelift in your 60s. At 75, you might need a little touch-up facelift. Well, you might need a little touch-up, modified spiral thigh lift in the future.
It's that principle you're going to keep aging. It is. Yeah.
Exactly what you just said there. So let's go ahead and put our before and after photos from the backside again. Yeah. So this patient has given us permission to show her photos to tell the world a little bit about her. So she's in her 60s, and she looks fantastic in the after photo. Mm-hmm. So in the after photo, we see a drastic reduction in the cellulite. We see a much improved buttock shape. It's nice and round, a very strong gluteal fold. And the reason that the gluteal fold is so strong is because there's a strong incision there where we removed extra skin.
Hidden, and you can't even see it.
You can't even see it, yeah. Now it goes, let's show the front, and you'll be able to see as a future patient or just a YouTube fan, that there are some incisions in the front, but they're hidden in that crease. And that's what's really important about this thigh lift. Because we're lifting above the underwear line and we're lifting in the in the thigh creases, we're hiding the scars really nicely.
Yeah.
And we're getting a powerful lift. And you don't have to have the old vertical scar right down the middle of your thigh anymore. Not everybody's a great candidate for this, but if you are, we'll be able to tell you that.
Yep.
Yeah.
Yeah, she looks great.
let's talk a little bit about some of the modifications that we did that make this operation different than what other plastic surgeons are offering. So, number one, we liposuction everything before we remove the skin.
Yes.
And then that fat volume, we save it.
Oh, it's important. Fat is liquid gold, so we want to save it for modification of the buttock size and shape afterward.
Liquid gold, also sometimes called Scottsdale gold, by the way.
Scottsdale liquid gold.
That's what I've heard, yeah. Not Scottsdale silver, but Scottsdale gold, guys, okay? And then we're going to transfer some of that fat where there's deficiency. So there's two deficiencies typically found on gluteal thigh lift patients. That is the buttock itself. It gets flatter when you lift it. It gets flatter when you lose weight. So we want to have a cute round buttock like this lady has in the picture after the surgery. So we're able to do that with maybe 500, 600 cc's, right?
Nothing crazy, nothing that's going to be over the top that's going to make people think like they've had a BBL, for instance. It's just to return you back to normal anatomy and take care of some of those flattenings that can happen with this lift.
Exactly. So when you come back from your recovery, people won't think you've been in Miami the whole time getting a BBL. Yeah, we don't necessarily recommend a big buttock like that. We do keep it very safe. We inject only above the muscle, which is super important to keep it safe. So if you're going to have a procedure with us or with someone else, make sure you discuss it with your plastic surgeon. Make sure they're keeping you safe. We also, as a side effect of doing the lipo first, we preserve the nerves, so there's less pain, and the lymphatics, no need for a drain, but also less swelling and a faster recovery because of that. So it's really a wonderful operation. Now, back in the day, about 10 years ago, there was a couple of studies that suggested that the most painful operation of all the plastic surgery operations out there was actually the thigh lift. And I think it's true if you're doing a traditional thigh lift where you completely excise the tissue and then you suture to the fascia, the fascia lata or the Colles fascia of the pelvis, that's going to be very painful. This operation completely avoids that by preserving a lot of the tissue and sewing connective tissue to connective tissue. And, you know, we mentioned that a lot of the patients, they've had a tummy tuck. And compared to a tummy tuck, my patients tell me this is about 60% less.
Yeah, I don't tend to have very bad, big issues with pain control with this surgery. Patients tend to be very happy. The swelling is minimal, and we're not having to watch that for weeks to months on end. So I think this new way really has advanced this surgery a lot to where it's more tolerable, and the results just are better.
Absolutely. What you don't want to do, there's some things that you should avoid with the modified spiral thigh lift. Like horseback riding, you probably want to wait a couple months before you do that again.
4 to 6 weeks at least.
Yeah, immediately after the surgery, getting in and out of the car, you want to keep your legs together. We have some another video where you're going to see soon some of the things that you can purchase to prepare yourself, like a grabber, so you can grab things that you drop on the ground. Maybe some other adjuncts that will help you to get to the bathroom a little bit more comfortably. But this is I think a simpler surgery for most women than a tummy tuck, and it's a great surgery for that sort of forgotten area where no man has gone before, the thighs.
It still needs love, and that's why we offered here and, give these women these great results that we can show you today.
And then finally, what I like to say is good scar therapy goes a long way. Silicone sheet's the way to go for my patients. The reason for that is you put it on, you can go about your business, you leave it on the skin for 12 hours while you're working, while you're playing, and then when you take it off at the end of the night, it's been doing some wonderful work to get those scars thin and nice. Mm-hmm. We have some promos you want to talk about, right?
Yeah, so now that it's May, we have our Summer is Your Time to Sizzle promo. So please call our office, inquire about what this deal is, and we would love to hear from you guys now that it's May with this great promotion. So don't be strangers, okay? Come and say hi.
Yeah, you can reach us at myfaceandbody.com for that promotion. And then we're also are we still having a photo challenge?
Yeah, so I think we'll have a May photo challenge as well, and we'll touch base with you guys about what that will be.
Yeah, so today's May 1st, and so we'll be able to get going on that photo challenge pretty soon here. I guess we must have fallen asleep on the wheel on the photo challenges. But typically when you're talking about the photo challenge, you want to go to azbreast.com on Instagram to be able to find us, sign up. It's easy. Send us some pictures. At the end of the month, we'll go ahead and judge who had the best results.
Yeah, we'll pick a winner randomly, and you'll get a gift card for somewhere fun and exciting. So,
all right. Anything else you want to say, Scott?
I mean, that's it. Thank you again for joining us on the Slice is Right, guys. We always appreciate it, and hope to see you guys again soon.
It's been fun. It's hot out there. Make sure you stay well hydrated. If you're going to go and hike Camelback this week, make sure you do it in the morning. Don't do it in the middle of the day. We don't want to hear that you've had the the firemen coming and get you.
Yeah, the helicopters are circling all the time, so be careful out there.
Thank you, guys.
Yeah, have a good one. Bye-bye.
Whole life's ahead of you. Can't waste it groping into the past.
We do it right.